Welcome to the Health Angle Podcast with Dr. Mike Headley and Dr. Gordon Fimwright, where we'll be exploring different angles of health to achieve the best version of yourself. Now, here's your hosts, Dr. Mike and Dr. Gordon.
Welcome, everybody. I am Dr. Mike Headley, and with me is Dr. Gordon Fimwright. Welcome, Gordy.
Hi, Dr. Mike, and welcome, viewers. Welcome to the Health Angle, where we pick a different health subject each episode with the goal of helping you optimize your health. And today's subject is going to be a combination of footwear, foot health, orthotics, and how they can really compensate into the body and cause different problems. So we're going to dive into that. You know, Mike, it's estimated by the age of a person, once they reach 50, the average person will have already walked 54,000 miles. And that results in 1 out of 4 people, adults, have varying degrees of foot issues. So it's very common. So I'm looking forward to diving into this. And the orthotics, the global orthotics, it's a $3.5 billion industry. So there's so much stuff out there. And I can see why people kind of get a little mixed up and lost as far as what should I do with orthotics or what should I do with footwear. So hopefully we'll discuss some ideals and maybe shed some light on that. What's your thought when it comes to all this subject for this week, Dr. Mike?
You know, I have been saying for 25 to 30 years, we need to really invest heavily into our beds because of sleep. And we talk about that a lot and how it impacts every topic. And then our shoes. We can't skimp on shoes. We have to invest in quality over quantity. I don't care if you have quantity as long as you have quality. Mm-hmm. And then as a chiropractor, I've been saying if we take care of our feet, our teeth, and our spine, in general, the insides of our body are going to be working so much better. And we talked about our spine and nervous system in this past as chiropractors, our teeth. Maybe we can have a holistic dentist interview in the future too, because that's critical to take care of our oral hygiene and our microbiome in our mouth. But our feet, every step we're going to get around is going to go through our feet. And so we really, really need to take care of that. And yeah, it's a controversy. Barefoot shoes, not barefoot. I'm kind of curious about your opinion. Orthotics or not? High heels, no heels, what? So there's, you talked about the orthotic business, $1 billion. What's the shoe? I didn't look that up. What's the shoe? That's multi-billion dollars. Yeah. Crazy.
For sure.
So just to kick things off, I was going to tell our listeners the top 10 or 12 issues that are statistically showing up in chiropractors' offices, podiatrists, other healthcare providers. Calluses, plantar fasciitis, Morton's neuroma, bunions, blisters, Achilles tendonitis, fungal infections, hammer toes, heel spurs or flat feet, neuropathy, gout. So those are percentage-wise what a lot of people complain about in their feet. So we're going to talk about a good amount of those as well. So Gordy, let's kick things off. What's your opinion on barefoot shoes? Good, bad, yes, no?
I'm not sure, Dr. Mike. And the reason I say that is because I get the philosophy behind it. They call them minimalists or barefoot running. Basically, what their philosophy is they want to have you exposed to nature, more or less. And they want you to have those feet exposed to the way they were supposed to originally, where all those muscles and tendons and the arches and all the dynamics of the feet are just getting exposed to nature, and they're under the stress, and therefore they develop as such. I kind of feel that in today's world, you kind of have to look at, like, we're walking on concrete nowadays. We have stuff on the streets. We got broken glass. We got potholes. And not only that, but you have to kind of look at the stress that we have put on our bodies. Some people carry bags on their shoulder, or they've been in an old accident or injury, and they've had poor posture. Basically, they switch the dynamics of their whole structure. And so there's a compensational effects that can happen. Compensation can happen from a bad foot being flat, and all of a sudden your pelvis is off and everything shifts. or you can carry a bag on a shoulder and all of a sudden you shift to the opposite side, to the pelvic, then you're putting more pressure on one foot or the other. So as far as like wearing orthotics or no orthotics, going barefoot or barefoot running or not, I don't know. I think in today's world, I think it's good to have a little support, but I'm curious what you have to say about it, Dr. Mike.
Yeah, my experience, I've had the 5-finger, they call them 5 fingers, even though it's 5-toe shoes. And they're interesting. And I mostly wore them in the yard and just for protection from sandburrs and rocks and things like that. I think it's really good to ground barefoot on the earth, especially beaches and sand. I think it's super good barefoot. But should we do it all the time? I think we really have to listen to our body. And we really have individualize it. No, not everyone should go barefoot and wear barefoot shoes. No, I don't think everyone probably needs an arch support or an orthotic. Yeah, what's your age, your lifestyle, occupation, athletic history, your weight, right? I know this for sure, Gordy. You shouldn't buy the $10 cheap flip-flops from Walmart. I know that for sure, where people just cave in and they're just walking crooked on that. So I am barefoot right now. I'm putting my feet on this grounding mat, and I mostly walk around grass and minimal and beaches and stuff like that. I don't go a lot of barefoot. So I've had patients say, wow, their knee and back and hip pains went away from wearing barefoot shoes, and some people even run in them. But my 30 years of experience as a chiropractor, Gordy, is people that use barefoot shoes solely, they can't go for years. They go for 6 months to a year, and then they have to kind of trade off and on. It's hard to just do that only. And then the orthotic thing, I don't think everyone's made for those, but it should be an assessment. I mean, if you're sitting and have good arches, but you stand and one or both of them drop, or you don't have any arches when you sit, and or you won't have any when you stand either and put more pressure. I think it should be evaluated, and then it has to be customized. You shouldn't just go to Walmart and pick out any random jelly, cushiony arch support and say, oh, that's good. It has to be customized.
Yeah.
And so it's a long answer to say it has to be individualized for barefoot and arch supports for me.
Couldn't agree more, Mike. And, I just want to give the viewers just a little insight. Like, when somebody comes in and they're getting assessed for, let's say, the spine, and want to see if the feet have any relationship. Well, first of all, my thought is this. In our body, we have 206 bones of the body, and we have 26 bones in each foot. So we have 52 bones right there in the foot structure and 206 bones in the entire body. So 1/4 of our bone structure is right there in the feet. And then every time we walk, we land with our heel. We have a mid stance and a toe off. And each time we take those steps, each of those bones have their own architect in motion, and they just move differently. Everybody's a little bit different, because when you do an assessment, you can look, if somebody's standing up, and you can assess those arches. You can literally feel underneath. And just to let people know, if you look at the bottom of a foot, there should be an arch called the medial arch, which is on the inside. There's also a lateral arch to some degree. It's not the big one that people think about. And then there's a transverse arch right in the middle. So there's 3 major arches of the feet. And when you get an assessment, you're looking to see how those arches are holding up, mostly the medial arch, a longitudinal arch. And if it's fallen on one side versus the other, that's kind of curious. You want to just kind of assess to see what's happening above that. Do they have a knee problem on that side or the opposite side of where the arch has fallen? Are they compensating by having some type of limp because of it? Maybe it was an old injury where they had plates put in, or maybe their hip has kind of compensated. Their shoulder could be showing, their neck as well. So there's compensation all up and down the spine. In fact, there's really, really interesting study done by podiatrists, and I believe it was done in a podiatry school. And what they did was they put a wedge in one of the feet of the participants. And what I mean by a wedge is they literally put a heel lift, a wedge to lift one side up higher than the other. And then what they did is they did an assessment of how that contributed to the body, positive, negative, no difference. And what they found was a significant amount of people had some type of compensatory problems. Some of them had increased local ankle pain, while others had knee problems, yet others had hip problems. And it goes all the way up, the low back, mid back, neck. So they found problems all the way up and even into the jaw. So can the feet make a big difference in that realm and compensating up? Oh, yes, absolutely. Can it contribute to some of the conditions that Dr. Mike just talked about, specifically to the feet, like bunion or plantar fasciitis? Yes, absolutely. It's a fascinating subject, but I think there's also more you have to look at. If your feet, when you're looking at them, they should be equally kind of separated. And sometimes people have a flare out. Now, why does it flare out? Is it because of an old sprained strain to the ankle? Was it because of a knee problem? Is it heredity? Maybe the hip? Hard to know unless you really do a thorough assessment and get a background on someone. But I also find it interesting that if somebody does have a sprained strain, what a sprained strain is an overstretch of the ligaments and muscles. And whenever that heals, it heals with less elasticity or flexibility and more adhesiveness or fibrotic. It doesn't move as well. As a chiropractor, I do adjust the ankles on people who need that type of work and breaking up that tissue, getting it moving. And I've seen foot flare improve so it actually is symmetrical. And I've seen other really positive effects to that as well, Dr. Mike. So what's your thought on compensation and how it affects people differently?
When you're standing, I try to focus on my feet pointing straight ahead, just standing randomly. That's not an athletic stance. It's not a power stance. Like we both played sports. Your legs, maybe shoulder width the height. Your feet are pointed outward a bit to have more balance and more forward. But if your feet are pointing straight ahead, then the muscles are pulling evenly in the shins and knees and hips and back. And when one foot flares in or out, compensation then begins. And typically when our feet are ducked and tipped out, well, that's going to torque the knee and the hip. And over time, it's just going to wear and tear on our knees and our hips. So structure really, really matters. If you're just sitting at the dinner table, you're just sitting watching Netflix, I say, well, let's just have our feet in a straight position so our muscles are pulling evenly. And be careful of our posture. Are we sitting on one foot at work or on the couch? How are we putting one foot on top of the other? Are we crossing our legs? Structure matters, but when in chiropractic, I think a lot of structure and function. So if someone is even standing ideally and their structure is on, then I want to check their mobility or their function, because it could be locked up. Like you said, you adjust the ankle and adjust the feet. And so one of my strategies, Dr. Gordy, I have like a lacrosse ball. You can put it on the bottom of your desk or on the floor, whether you have a stand-up desk or a sit-down desk, or you're on the couch watching sports or TV or reading a book or whatever. And I tell people to roll for 5 minutes with a lacrosse ball on the bottom of their foot, just general mobility. And I think that's really powerful to stimulate the nerve endings. And it's not a reflexology treatment or anything like that, but little strategies like that can be very beneficial. I personally soak my feet in Epsom salt once a week. And someone, my wife's parents came in one time. She goes, "Oh, geez, you hurt your feet. What's wrong with your ankle?" Oh my God. No, I just do it because it feels good. It's relaxing. And it's just good foot care, I believe. Mm-hmm. And so do you have any other routines or recommendations for home care like that, or stretches? Or
well, I mean, like you're soaking feet, you can also soak it in baking soda. Put some baking soda in there. And then if you feel like your feet are kind of smelly, you just put some baking powder right into your socks, and that dries them out. A lot of times if it gets too moist and you're at work, and some people have different glands. Some people sweat more than others, and in the feet as well. So if they're sweating too much and they go, "Oh gosh, my feet, I don't know," well, put some baking powder in there, shake it around, and that is a good remedy. Well, I think sometimes people come in, and if I had to guess, the more common foot problems that I would see in the office that they happen to have I'm not a podiatrist, but they happen to have it, we can treat, through adjustments in other realms. They'll come in with plantar fasciitis. That seems to be a big one. And plantar fasciitis, if you look at the bottom of the foot, plantar fasciitis, that fascia, that sheath, that soft tissue becomes kind of overstretched in a way, becomes inflamed. It becomes tender, just really uncomfortable for some people. You can get it because you're running, too much running for some folks. Some people, it might be because a foot has a flat foot on one side, or it could be because they're getting a little bit older and their tissues are changing. And maybe someone's standing for long periods of time and that sheath just becomes tender. It's really irritating. So one of the things that I do and recommend for that, first assess to see if it's fallen or if the arch is too much. And then those are good candidates, in my opinion, for orthotics. And we can talk about orthotics here in just a little bit. And then what I do is I have a kind of like one of those Coke bottles, right? The plastic ones where they have the contour shape. And what I do is I fill it up with water, put it in the freezer. And then if you put it sideways, those contours will fit perfectly with your foot. And you can literally do like an ice massage. So you can ice it, and while you're kind of rolling it back and forth and getting a little bit of massage as well. And obviously rest is good for those things, arch support. One of the conditions of the feet, and it happens on the heel, and it's called the heel spur. And sometimes that can be in conjunction with the fascia being tight, in conjunction with the fasciitis, and they'll get just that little bit of that spur. And what that is basically kind of calcium buildup, because it's been constantly kind of pulling, and that heel spur develops. And sometimes a good donut, put a nice little donut, assess if orthotics are needed, and then also rest it if need be. And obviously if it's outside the scope, it may need to see an expert or somebody who specializes in that type of work. How about you, Dr. Mike? Is there any other hacks that you kind of recommend to people?
Yeah, I use a company called Soul Supports, and here's an example of what they look like. And they seem like they have a really, really, really high arch. That is my experience. I've had everyone who's got these has gotten over plantar fasciitis, because it addresses the cause. You can ice and heat and rub and put different essential oils and Coke bottles and all that other stuff on there. And I think that's really, really, really good to treating symptoms and to really soften up the feet. But I'm a huge fan of this company, Soul Supports. So what's really unique about this, Dr. Gordy, is their foam is a triangle. And so if my hand was my foot, I would set it on there, and they want to capture the foot in an ideal state so then everything can stack up properly on top of it. What's really, really common is you stand on a scanner in stores and they scan your foot, or chiropractors or other podiatrists will have you stand up in a box of foam. If the average person drops an arch 1 to 3 millimeters, sometimes 7, 8, 9 millimeters. So if you have a faulty arch or a pronated or supinated foot, you're capturing a non-ideal structure, and you're supporting that structure in a non-ideal state. And I go, well, okay, it could be cushiony, it could feel good, and it could be a good addition to your shoes. But what's really, really cool is I place someone's foot on this triangular foam, and I push their heel down and bottom out the foam, and then I push their toe or that frontal arch like you talked about down, so it captures an ideal arch in a sitting position. And that's, most people have a really, really high arch when you capture an ideal arch, and then it really fits their heel like a glove, so then they can't pronate or supinate. It's semi-rigid. I've had a pair 10 years, so they last a long time, and they are rigid, but they allow every bone in your foot, the 26 bones, like you said, to move properly. So I'm a huge fan of capturing an ideal arch, Dr. Gordy. Mm-hmm. So that's number one. What other hacks I use? I'm a big fan for plantar fasciitis is getting a muscle scraping tool. you can use the back of a butter knife. So you just put some lotion or gel, and you can go on YouTube and go muscle scraping for plantar fasciitis. It's 2 to 5 minutes a couple times a week, and you put the lotion on there and you scrape the fascia on the bottom of the foot, and you feel gristle and grit in there because there's adhesions, and it might be a little bit sore. But what it does is it brings more blood flow to the area, and it helps oxygen support the collagen and helps it repair. And then it blocks some pain signals when you scrape it. And then it just targets the fascial adhesions. Then it helps with your foot mobility. And then if you put a good structure into the arch to support that, then you get the right shoe. It just, the symptoms go away. And then guess what? Your knees and hips and back, hold a lot better, and you're just able to get relief. And so I'm a huge fan of that, Dr. Gordy. And then two stretches I really, really like. So you can rub the fascia on the bottom of the foot, and then hit the Achilles tendon and the calf muscles too, because they're almost always tight in the calves. And so toe raisers, stretching the Achilles tendon, stretching the calves, doing lunges against the wall, putting your foot against the wall and leaning in. So stretching those and stretching the fascia gently and comfortably, gosh, people are just going to get relief instead of drugs and cortisone and opioids and all that dangerous stuff. And we can do that all naturally.
That's great, Mike. I just want to reference a journal, and I want to talk a little bit more about orthotics as well. So the Journal of Orthopedic Reports, it was in March of the 2024 edition, and they took an in-depth analysis of orthotic solutions, and mostly flat feet is what they were looking at. And they thought that the off-the-shelf, in other words, you buy from a retail store, can be a good choice for most patients with those special needs. Not suitable for everyone because of the size difference for, person to person, but the custom-made orthotics are often, of course, the better choice. And that's exactly what you were talking about, the company you use. I, in the past, have used a company called Foot Levelers, and the same thing. They have some type of special mold, I should say, that you step in and they take a reading. They also have digital where you stand up and it takes a digital print of it, and it checks out the arches and see where your deficiencies are. If you need some extra support for the heel or some other support with an arch being excessive, I think they do a good job with keeping those type of things in account when they produce these orthotics. I personally, Mike, I don't have anything major with me personally. And what I was doing was I was taking these orthotics that were kind of off the shelf, but they weren't just off the shelf, because there's some that are really bad. They do not support the structure or the arches at all. There's no support, and claim that they have really good arch support. And you look at them, they're really cheap and flimsy. I'm not going to name a name. So what I started to do is I started to get either like a Power Step or a Super Feet. These are retail. You can get them on Amazon. And I was wearing those. And the reason I got those too is because a lot of these athletic shoes where you have runners that are putting in 100 miles a week or thereof, they're really loading their arches, and they were sold in these running stores. So there's been a lot of research and good quality in these types of orthotics. What I liked about them is, and I'm not talking about custom orthotics, but these are people who may not have a condition or just want to prevent. So they use these, they take their insole that's currently there, take that out, and either put the Power Step or the Super Feet in there, and you can get 3/4 length, so you can put them in and out of all your shoes if you'd like. But it's got like this kind of this harder plastic where it gives enough, just enough. So if you are bending or running, it'll give just enough, but there's definitive support. One of the problems I have with traditional orthotics that don't give, they're solid as a rock. If there's 26 bones in the feet and you have a rigid orthotic that has no mobility, no movement at all, something has to make up for that lack of motion. And it's usually the joints above it or below it. So I think there's got to be a critical look. If you're doing these orthotics, there's just absolutely no movement at all. I'm just concerned about the compensatory whenever you immobilize joints, because something has to make up the difference. There's another shoe orthotic that I personally also use. You can get on Tenu. Not expensive, but it's the same type of thing. And I do have my share of foot levelers as well. So I kind of go back and forth. But so how about you, Dr. Mike?
Yeah, like I said, my number one customized arch support, sole supports, around $300. My number one non-custom arch support is Superfeet, like you said. And I didn't know that you recommended them or like them and use them, and $50-ish. And so its price, you're going to have to pay more for a custom arch support. Get a cast, send it to a company, fabricate it, mold it, whatever. To me, if $300 lasts you, 10, 15 years, and it makes your shoes and body last a lot longer and you can get more production out of you, I think that's really good investment. So yeah, Superfeet, sole supports. There are some other good companies out there. A couple other just basic things is socks too. A lot of people have bunions these days, and it's not just from high-heeled shoes. It's not just from really tight shoes. Socks can really, really bind our feet together, and then you squeeze that into a shoe without the footbed. And so I have some really good recommendations for proper fitting shoes. But yeah, really, really assess your socks. They have to be comfortable, breathable, like you said. Some people sweat a lot, or you can have cotton only, and then it chafes and rubs, and then you get calluses, or you have blisters and things like that when you're exercising or working out. And so I see a good amount of bunions, and again, and hammer toes and hallux rigidus, as they call the big toe, is the hallux. It gets so rigid, and or it gets a bunion, and arch supports, and then what we said, the plantar fasciitis routine really, really, really works good. Achilles tendonitis is any kind of tendonitis is itis. Come back and watch and listen to some of our podcasts about inflammation and diet and Gordy's smoothies and things like that will help inflammation. Fungal infection, that's an internal thing. Watch our podcast and listen to our podcast on gut health, because that's an internal thing, instead of finding some fancy gel and just I'm okay with putting stuff on the outside and soaking feet in baking soda and baking powder and Epsom salts, but we got to fix the gut when there's fungus in the body. Hammer toes I see occasionally, and then heel spurs. Gout I've been seeing a lot of. I don't know about you, and people complaining about gout, and they just think it's a big toe problem, common, it's a foot problem, it's a joint problem. The cause is the beginning of kidney failure, and the body's not filtering out that uric acid, and the farthest away from our body is our big toe, and it just pools down there. And so you can do a lot of symptomatic stuff and soak the feet, and you can do a lot of things. However, you really have to clean out the kidneys and clean up the diet, the alcohols and the sugars and the bad foods and the rich foods and the increased proteins not digesting. And I mean, there's celery juice. I've had people, everyone who has a juicer, they'll juice 3 celery heads 3 days in a row. They get rid of the symptoms. I mean, it works way faster than any drug or medication, but then you still got to work on the diet and get to the cause, and really taking care of that. So gout, can really, really, really be nasty. And then one of the other nasty things I really don't like working with is neuropathy. Because that's not just like, okay, let's adjust the L5 and now the nerves to the feet are working good. That's usually diet and emotional and physical and structural. So neuropathy is kind of nasty, especially when it's diabetic, especially if it's been long standing and people can't even feel their feet. But you just got to hit it all: physical, chemical, emotional, and really find the cause. And my experience is structure and function. Work on the structure, work on their function. If they need customized supports, if they don't, give them some inexpensive, non-customized support. Always work on their diet and what they think and how they move. And they'll have really, really, really good results, reducing inflammation and stress points on their feet, and getting a ball and massaging their feet and a bottle with ice in it, and muscle scraper, all this stuff is pretty inexpensive for as much demand as we put on our feet and how much stress we put on our feet. I don't know. Tell me if this is accurate. Our weight times 4, if I'm 200 pounds times 4, 800 pounds when I'm running, that's 800 pounds of stress on my feet when I'm running. Probably maybe half that, 400 pounds-ish when I'm just walking. But that is that pretty accurate? If it is, that's a ton of stress, isn't it, on my feet?
Yep, you put like at least 3 times the weight of your distribution every time you do a heel strike when you're running. And then, of course, if you take into account, Dr. Mike, 2 out of 3 Americans are either overweight or obese. So they're exponentially increasing the load. And most of those people are probably not the muscular type, the overweight as far as muscular build, and then you'd have the muscle to support that type of weight. So yeah, big time. And that, Mike, I want to say one thing about bunions too, because that's kind of, that's a big thing. I think a lot of women that I would see have these shoes and they want to look good. They put the high heels, they're really tight in the front, and the bunion is just starting to develop. They're starting to feel it, but they look too good in those high heels, so they continue that. And I know that they make bunion reducers, and I don't have a lot of experience using those. I don't know what those look like. You see them in social media where it'll take the toe and it'll just kind of force it outward, so it doesn't have as much stress onto that big toe at the joint of the big toe. And they want to take the tenderness and some of the inflammation out of there with that type of device. But ice and getting a looser fitting shoe, I think would be ideal. And speaking of shoes, Dr. Mike, we can segue right into the shoes. I know there's different shoe recommendations, and I just had a patient today and I said, "Hey, how do you like your shoes?" And I've seen other people with the same shoe. It's the Hoka shoe. It's a type of running shoe. They're a little bit oversized. The insoles can be taken out. They're a little bit cushiony as well. And so that's kind of a shoe that I don't know much about, but I've had a few patients come in and they seem to enjoy those as far as their comfort level. Do you have your favorite shoe? I got a couple more I can share as well.
Yeah, I am going to have a link to an ebook that a credible orthopedic company that puts a shoe guide together every 6 months, because shoes change all the time. In general, they recommend Hoka's, New Balance, Brooks, and Asics, but they really get specific. How's your heel? How's the counter? How wide is your foot? Do you have a high arch, low arch, rigid foot, flexible foot? People with that hallux rigidus, that's the only type of foot they recommend for the rocking type shoes, those curved bottoms of the shoes. Not everyone should have those, because when you can't move your big toe, well, then you can rock and still get other bones to move well, and it really supports you. It's just not a novelty. Oh, let's get that curve on the bottom of my shoe. They're kind of cool. That might really goof up your gait in your ankles, in your knees and hips and back. So it gets really specific. So that's a really good ebook guide that you can request, and we'll put the link under our video. But here's 4 general rules to know that you have a good foot. Shoes should feel comfortable right away. You shouldn't need to break them in. Tighten the shoelaces from the bottom up. Shoes should be tied tight enough that you need to untie them to take your shoes off. This will help you hold your foot in the shoe instead of just slopping them on and off. You should be able to sense your heel arch and big toe on both feet when you're walking. Think about that. You should be able to sense your heel, your arch, your big toe on both feet when you're walking. If you don't feel it, if you feel like thud, 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 that's probably too tight and rigid, and you should be like gloves. You have gloves on and you're driving. You should feel your fingers in the steering wheel, and we should feel that when we are walking. Your heel bone should not slip up and down in the shoe when you walk. You shouldn't have calluses. You shouldn't have blisters in your shoes. Lastly, if you stand and balance on one foot with the opposite leg in front of you as if you took a step, you should be able to balance and sense your heel, arch, and big toe on the ground all at the same time. And if you can't sense all 3 together, the amount of support of that shoe is not ideal for you. That's a simple test you can do in a store. Geez, do they feel right away? If the clerk says, yeah, it takes about 3 months to break these in, yeah, that's pretty rigid, and they should feel really comfortable, and your feet shouldn't slop around in the store. Stand on one foot, the other foot out in front, and see if you can feel the heel, the arch, and that big toe all at once. You go, wow, these are probably really good shoes. And measure your shoe, measure your foot and your shoe to see if it fits right. Really have someone take some time in the store. And if you order them online, they have pretty good devices where you can, questionnaires that you can fill out. Geez, do you pronate? Is your arch this high? Measure your foot and order the right shoe online as well. So my number one recommendation is Brooks. Number two would be New Balance in general, and then Asics, and fourth, Hoka's. But there's a lot of other companies that are really, really good if you use those criteria. How about you, Gordy? What do you like?
There's a couple that caught my attention. So the first one is called Abio, and this shoe is especially made to accommodate bunions, plantar fasciitis, and heel spurs. They're orthopedic shoes, of course, and they look just like regular shoes. So that's number one. Number two is Cheka, and this brand is endorsed by the American Podiatric Medicine Association, and it's an approved casual shoes, and they also have sandals. And they're supposed to have amazing arch support and adjustable width as well. So those would be the two shoes that I would recommend. And then how about, Dr. Mike, how about sandals? I know that's kind of a hit or miss thing as far as what sandals are good with arches and good support, considering they're just sandals.
Yeah, the most I see in my office are Birkenstocks still. And some have the attachment around the heel. Most don't. People like the freedom of that. People like sandals. There's a new brand out there, Echo, Birkenstocks, and then my last sandal recommendation, Dr. Gordy, is OOFOS. OOFOS is shoes and sandals, OOFOS. My wife has a pair of shoes, and my mom has a pair of sandals, and they call them recovery sandals because they're cushiony, but they really, really support that arch. So a lot of athletes I see take off their basketball shoes, hockey skates, and tennis shoes and volleyball shoes, and then they slides and glides, whatever the kids call them today, and they wear the flip-flop stuff. But they aren't really supportive. I see how their feet can breathe and relax, but if you have these recovery sandals with arches that are cushiony and can kind of massage your foot and still give you that support after your practice or your game or cross-country running or whatever tennis match, that makes sense to me. So OOFOS, Birkenstocks, Echo are three brands I recommend.
Yeah, and Echo also, they have a great shoe brand, and that was one of the ones that I looked at as far as shoes go. I use a sandal. It's called the Reef. This is actually it here. It's got a wonderful arch support. There's a little lateral arch support there as well, and they're a really high quality sandal. It's called the Reef. And then, of course, if you have your arch, this is what the foot looks like for those watching on YouTube. It fits right. It's just a really nice fit to that arch. And then I just also want to point out, Mike, just to summarize the orthotic, this is my 3/4 length. It's got like kind of a harder plastic on, and it just doesn't have that floppy give. It is solid. So if somebody's looking for these, I mean, we had mentioned a couple off the shelf. If you don't get a custom, I mean, just make sure they got a nice hard plastic so they're supportive. And you can see the different transverse, arch, and longitudinal of both the medial and lateral. So that's all I have for today's episode, Dr. Mike. Good information.
Yes. And, just I would like to add a little something personal, since I mentioned in the past that I broke my right hip 22 years ago. And so it's worn pretty hard and so I'm really particular about what shoes I wear. And I wear something called ugly shoes. I wear something called Z coils. ZCOIL.com. They advertise that they absorb 50% more shock than any other shoe. And I call them ugly shoes because some of their shoes have this spring in the heel exposed, and they're ugly. But I've hiked 2 mountains in Spain, and I've had one pair for 15 years. They have tractor tires as tread on the bottom of them, and I wear a pair of boots in my office currently when I'm working on patients because I'm standing a lot. And Z-Coil, my favorite shoe there is, but I've went outside the box a little bit, Gordy, as I got 2 different pairs, something called Kuru, Kuru. If you really look at them and you look at the videos online, is it really supports the heel. Takes about a month, they say, on every shoe to break in. So I just said, if your tennis shoes don't feel good in the store and they say don't break in, but I got them anyway because they don't need to be broken in as much as they need to be adapted to because they're different. They really support that heel and they're really, really cool. So I just wear them in the office right now. I trade off. And then last pair I have is something called Kybun, Kybun. And they're made in Italy. And they're more attractive. They're better looking. But they take a while to get used to, but they really absorb shock. And it's like you're walking on pillows, but they support my foot so I'm not flopping all over. Z-Coil, Kybun, Kuru, if you're looking for something different, have some pretty nasty knee and hip and back and really want maximum support, maybe not the most stylish shoe that you'll see on the runway and modeling shows, but they're really, 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 really good. And so with that, I would like to close our topic of foot health and foot solutions with what's your number one takeaway that you can share with at the dinner table? Maybe it's not fun to share about feet at the dinner table. Maybe it is. But what's your number one takeaway that you can share at the dinner table about, hey, ask your family or friends or about their feet. What's your favorite shoe? Why do you choose them? How do you like those? Geez, I've never heard of Kybun. What's that? Oh, geez, I see that. I've never tried Asics. What's your experience with those? What's your number one takeaway? What's your number one action step that you can do to improve your foot health? And that's what I have for challenge you to what's your number one action step that you can take to improve your foot health, maintain your proper good foot health. Can you look at some other sandals if you love the sandals this time of year? Can make sure they're healthy for you and you maintain good health. And if you have some bunions and plantar fasciitis and really take some of our action steps that we gave and see the right professional and fix the underlying cause. So with that, Dr. Gordy, what's our next topic for next week?
Well, next week, Mike, I'm excited to talk about diabetes, and it does touch home. I'll share the story next week when we talk about diabetes. 3 number one killers are heart disease. We had our podcast last episode, so please check that out if you haven't seen that. Heart disease, heart health. Cancer, that's another big one. And we're going to talk about diabetes, and we'll go through things that people can do to prevent. What are the early onset diabetes, what are the symptoms and solutions, and we'll go through supplements as well. So I'm kind of excited to go over that subject. Absolutely. And if you haven't already, please subscribe, please like our content, and we will see you next week.
Thank you for joining us on the Health Angle Podcast. Please subscribe to our channel and catch us for our next episode.